Hi everyone, this is Iveta. I want to talk about expectation towards physical therapy, rehab, or exercises in general that we all get prescribed and recommended to do physical therapy. And so frequently I see a lot of women, they say physical therapy didn't help me. I tried for 6 months, or things like, oh, I'm doing physical therapy, been doing physical therapy for a month and I don't see any improvement. So I'm gonna talk about what the expectation should be, how long things take in the body to heal, and what you need to consider when you go for physical therapy or rehab or do one of my programs. So you want to take into account the provider. So whether you buy an online program from me or someone else, or you go see a physical therapist, not every provider is born equal. So my pelvic floor therapist gave me Kegels and sent me home. Not good. Okay, that's not a good one. And some that they're ones that are good, and some they're like okay, and some they're perfect. Like they take a holistic approach and they spend that time with you. You will need to take the time find out which one is yours. Okay, it's just like there's no way of knowing. You can get a recommendation, you get recommendations and referrals and everything, but ultimately you need to learn a little bit about yourself to know which provider is good, and so you're able to piece the pieces of the puzzle together so it makes sense. Okay, so then the second point is, how long did they tell you that you have to go see the physical therapist, or how long is the program for? So frequently I see they say, well, 6 visits, 8 visits, 10 visits. Like, based on what? Why? How? Where's the number come from? Do you want to ask that? Why? Is it because my insurance covers that? Frequently they don't say it, but that's what it means, because, well, insurance covers 10 visits. So there you go. You're going to see me 10 for 10 visits, 10 times, and then you're done. Does it mean that you're healed? No, it just means it's just like insurance pays for it. Doesn't have anything to do with what your body needs. Okay, but do ask the physical therapist for like how long you think it's gonna take, and the answer always should be, well, it depends. Okay, and it depends on number 3, how often are you able to do the exercises during the week, for how long and how frequently. Okay. Then it also depends, number 4, on what are your daily activities. So let's say you have a physical job where you stand a lot, where you work with kids, let's say, and so you pick up chairs, you pick up infants, you work in a kindergarten, or you lean forward to do small people, or you sit a lot and you bear down a lot and you're hunched over for 8 hours. And then you do the 30-minute exercise a day. Let's say even every day you do your 30 minutes. But then for the 8 hours, you're bearing down, you're gripping your abs, putting pressure on the bladder, on the diastasis. Do you think 30 minutes a day, or even 60 minutes a day, will help you progress? Probably not, because it's 8 hours versus 30 minutes, right? So you have to take that into account. Rehab is also how you move in daily life. So find someone who teaches that, like who can show you that, what to do in the daily life, when you do the dishes, when you walk, when you go for a hike, when you're at your job. Okay? And then that's what I see frequently. I did my exercises, I didn't see any progress. Well, yeah. because it was just not enough to progress. It was just barely enough to offset the damage that you did during your daily life. Does that make sense? And then you have to, number 5, take into consideration what kind of damage, it's not damage, I'm sorry, what kind of dysfunction you have right now in your body. And does it include like muscle or fascia? So abdominal separation or prolapse, they frequently involve fascia, not muscle. And fascial healings, it takes longer than muscle. Okay, the remodeling takes longer. It's not a muscle, it's just it works different. It takes longer. Okay, so you have to take that in account. Usually for muscle to get stronger, we need to strengthen it. So you get the little bit soreness, you get the blood circulation, you get the rebuilding, and that takes like 4 weeks. Fascia takes longer than that. Okay, so you have to take that into account. It's a marathon, it's not a sprint. Then when you're learning a movement, all this rehab stuff, the breathing and how to engage a certain muscle and do not engage another muscle, it's all in the brain. Okay, it's so difficult because you're unlearning a habit that your body has to build a compensation. So you're overusing your upper abs, you're not using the lower abs, and you have to learn a habit. You know already where I'm going with this, how difficult it is to unlearn a habit. It's very difficult. Okay, it's possible. It just takes time, step by step, right? So just be patient with yourself. And then movement comes from brain. Okay, so we move because our brain tells us to. Okay, but when a muscle is turned off, like during pregnancy, due to pregnancy, it's 9 months. You turn off the lower abs that go weak and stretch out. And so we lose the muscle-brain connection. When you're in menopause and you got a prolapse or you have an urgency, you haven't been using certain muscles for a long time. I can tell you that because there's some weakness or tightness. So certain muscles are super overactive. So we have to retrain and change the brain muscle connection. And especially in weakness, there's just not enough like neurons in the muscle. That's why we can't move it. When they tell you like do a Kegel, it's like you can't move there because you haven't ever used your pelvic floor. You don't know to do a pelvic floor contraction. Okay, so first 4 to 6 weeks is just this neural remodeling, like connection. Your brain keeps sending signals there and realizing, well, I don't have any signals in your low abs. I don't have any signals or any neurons in our pelvic floor. Maybe let's do that. And this remodeling takes some time. You're not strengthening the muscle yet because the muscle cannot do a maximum contraction. Like you're working on your abs, your lower transverse abdominis. You are not engaging your muscles to the maximum that they can because there's just not enough neural activity there. So you have to build it there. So that takes some time as well. But then it clicks one day and then you'll go like, that's when you can get strong, okay? So you have to, like skip a hurdle, have to go over the top of a hill and then it's like, yes, now it's working, okay? This all takes time. So I have some expectations. Number 7 is our bodies are interconnected. So when you go to a PT and with a pelvic floor issue, let's say, then you'll discover layers upon layers of compensation. Like you're tight here and you're weak here, and then something with the upper body, with the upper abs, and your serratus is not working in a forward-headed posture. And then your hips, like you can engage the hips because then the hip is hurting. I did all that. So in my rehab, I had to fix my piriformis syndrome that was sort of bothering me, but not really. My IT band I was tight, so I couldn't run for long, but you know, who cares? I didn't run anyway, so it didn't bother me. But when I want to heal my leaking, I had to fix all those imbalances. So chances are that in your PT journey, in your rehab journey, you'll be discovering layers, and this is good. This is good. You'll be discovering like, oh, I need to fix this. Oh, I need to fix this. I need to fix this. That's good. You're learning about your body finally after so many years that you were neglecting it. So this is good. But you have to take that into account. Like you have to, oh, now I have to skip over here. So I was working on my abs, but I found out something in my hips and my glutes. So I have to work that a little. And then I found this, you know, that my serratus is not working and I was hunching. So now you have to strengthen the back so I can straight forward. So I'm not gripping and, you know, bearing down because my spine is now like totally curved and I cannot engage my abs because they're inhibited because the way my spine is an S shape. So it's like, oh, you have to do all things together, but the progress should be like you going up. Maybe there's like a regression, you go down, but then you go up. You go a little regression, you got a little sore and a little hurt, and then you go up. So it should be upward, your progress, okay? There will be dips, but it will be upward, and that all takes time. So don't think about your goal, okay? Think about the journey. These are all the things that you should consider when you start physical therapy or buy a program from me or just do any type of exercise, okay? Thank you very much for listening. You hit me up with any questions you have about this. Did it make sense to you? It's just logical sense, okay? So let me know what you think. Write hashtag replay if you listen to this in the replay, and if you're doing physical therapy, right? If you're doing physical therapy or some sort of an online program or some program that involves rehab and exercise. See you. Bye. Thanks.